Welcome to Emergency Chaos, where we provide tips and tricks to make you a better ER nurse. Today, we are talking about a common questions new ER nurses often have. What should a new ER nurse focus on? Well, let's get into it. As a new ER nurse, you need to be proactive with building your foundation. So being proactive means taking charge of your experiences, the patients you get exposed to, reading outside of work, asking questions, and keeping notes. In the very beginning, you should focus on having a solid understanding of ACLS, PALS, ABCs, common conditions, and your assessments, which include what questions you need to be asking. ACLS and PALS are essential in the ER as they involve rhythm issues like VTAG, VFib, SVT, and symptomatic bradycardia, just to name a few. They'll also cover respiratory and cardiac arrest, as well as go over airway management, critical care medications like epinephrine and amiodarone, and also the treatments for strokes and acute coronary syndromes. The ABCs are also extremely useful as they are essential to assessing and stabilizing sick patients in the ER. So ensure to educate yourself on the components of the ABCs, which entail the assessment portion and the treatments or maneuvers. And of course, common conditions and assessments for each. These can include CHF exacerbation, STEMIs, pulmonary embolisms, allergic reactions, seizures, and GI bleeds. Familiarize yourself with how they present, the workup, and the treatments. So, regarding exposure, you need to be hands-on as much as possible. I know that it can be very intimidating, but you should be asking your charge nurse, hey, can you give me the sickest patients if possible, from newborns to geriatric patients, so that you can see the different types of conditions that are commonly coming through the ER, as well as getting a good hold of critical care patients when they come in really sick. This will build your critical thinking and polish your skills. If there's a sick patient on the unit, if possible, go and help. Think of questions that you can ask your preceptor or you can even look up. Watch all of the procedures, whether it's a simple chest tube placement, intubations, or even when they're placing any type of drain. Then at the end of the day, you need to review and go over what you learn. And if you have any gaps in your knowledge, you need to be looking it up. And again, ask for the sickest patients, because when you're training, you have your preceptor there with you. So it's the best way to get exposed as much as possible. And remember, seriously, no question is a dumb question. You are building yourself. You are dealing with people's lives. So ask away. That's how you're going to improve little by little. That's how you're going to build your knowledge. Try to answer your own question to get you thinking, then ask your preceptor, your educator, or even your provider to ensure you have the right information. Or even look it up when you get home, right? Bottom line, ask away. It shows that you care and are invested in learning and bettering yourself, and that you really want to take good care of your patients. And for this one, I know that on your days off, you want to be off, but I recommend that if you're able to, I suggest picking up an emergency nursing book and reading for just an hour to ensure that you are constantly educating yourself on ER nursing related topics. It's just an hour to get your mind going, right? I know that on your days off, as I said, you want to be off, but in the beginning, when you're precepting, when you're training, when everything's so new to you, I think you should be constantly grinding away and getting information and knowledge into your brain. If you do so, it's going to get to the point where you see something in real life that you had previously read about. And because of it, you're going to have a better understanding of the patho and the treatments used. The key is that you are constantly building your ER brain, even if for an hour of reading on your days off. Little by little, things will start to make more sense. And then one of the more important tips is to keep a brain, meaning a small notebook that you carry with you where you write things down you are learning. For example, today you had your first CHF patient and you write down the treatments, right? You can later add on to them or review them and keep on building your knowledge. It also helps because there's certain conditions that you can see just every once in a while, right? For example, you saw something once in your preceptorship and now you're on your own, but you had written it down in your book and in your brain, in your little notebook. You can go back to your notes and refresh yourself on the treatment and on what you do as the nurse, right? And then just know that it's going to take time. It is going to take time, so be patient with yourself. I find that it takes approximately a year for things to start to come together. That's when I've noticed that new nurses feel more comfortable and start feeling a little more confident in themselves. The key thing is to be patient with yourself, but you must be strategic and proactive with your learning and your experiences. Take the time to appropriately build your foundation so that you can be a safe nurse for your patients and for yourself. Now let's get into the question of the day. What coronary artery, when occluded in a STEMI, is commonly referred to as a widowmaker? Again, what coronary artery, when occluded in a STEMI, is commonly referred to as widowmaker? Thank you for your time today. I hope that I was at least able to teach you one thing. If you want to keep learning, I've listed my favorite ER nursing related books in the description, with my favorite being Sheehy's and the Case Files. As well, please take the time to watch my other videos. Also, if you would like to help support the channel, I have nursing stickers and shirts on Redbubble that you can check out again. Thank you for your time today. And as always, teamwork makes the dream work, and here at Emergency Chaos, we are proactive, not reactive.